Hello, everybody. It is November 8th, 2021, and we are delighted to have with us today Dr. Vin Gupta. I am honored to call Vin a friend, and I've known him for quite a number of years now, and it's been really exciting for me to see the role that he's played throughout the pandemic. So I'm going to turn it directly over to Vin, who will tell you about what he's been doing throughout the course of the pandemic. And I'm going to put a little bit of pressure on him to tell you a little bit about what he was doing pre-pandemic, so where he was in his career when coronavirus emerged. So Vin, over to you.
It is, thank you. It's a privilege to call you a mentor and a friend, and thank you for the invitation. I'm really excited to be here with all of you and to just chat about, I'll spend maybe the next 25 minutes or so just chatting about what I've been doing in sort of career arc and trajectory. And I'm hopeful, I'm going to try to put it through the lens of not just reciting how I keep myself busy, but ways in which I think this could be useful to all of you as you're embarking on your careers in public health and healthcare more broadly. And so forgive me for being guided by slides. I don't mean to talk at you, but hopefully this can be a discussion. Before I delve into these pivot points, as they call them, and I'll sort of enumerate some of the projects that I've really sunk my teeth into over the last 20 months. I was, before the pandemic in sort of late 2019, following a very sort of traditional physician scientist path at the University of Washington full-time. So I was 80% dedicated as just a epidemiology researcher, data metrics researcher at the Institute for Health Metrics and Evaluation. And then 20% of my time was as a pulmonologist, and just being on the teaching service at hospitals within the University of Washington system. On the side, I'm a reservist in the Air Force. They helped pay through medical school. So I've owed them a reservist commitment over the last 9 years. And I'll talk about that in just a bit because it's reared its head in some unexpected ways over the last 20 months. But that was my life in 2019. I really liked it and felt fulfilled. And towards the beginning of 2020, actually moments before the pandemic hit, there was this interesting opportunity that popped up at Amazon that I ended up pivoting towards as a full-time job. I still maintain a role at IHME and still very much clinical. But it was an interesting opportunity to scale telemedicine for at-home use. Think of healthcare, but with the convenience of prime delivery. And we were thinking about this before the pandemic, before everybody was at home, and certainly things have changed dramatically in how people think about consumption of healthcare. So I'll get into that. Actually, my first and second pivot, this sort of data revolution that we live in, and the home healthcare experience and how that's really dramatically changing. So I made that pivot, and then the pandemic hit, and things have just been really organic for me. And I've tried to just seize opportunities to have impact as they've presented themselves. And I'm going to talk to you about some of those opportunities in the next 20 or so minutes. But I want to do so through the lens of saying, from my own experience, that I felt ready to really have impact and to be credible at a time where the world, I think, needed more folks like Dr. Katz and others to really step up and bring cross-sectoral expertise to really help pave the way for our response. I was in a place where I've spent the last 15 years of my life doing a lot of different getting a lot of different educational experiences in international relations and public health, trained as a pulmonologist, was active duty in the military for 18 months. And all those experiences really came to bear and were really extremely helpful over the last 20 months as I've tried to be as useful and as impactful as I possibly can be. So I say that to all of you to say that don't be afraid to push against dogma, to take, I know this is going to sound cliched, but to pursue opportunities after you finished your degree that might seem against the grain, because often cross-disciplinary training and expertise will be rewarded, because we're entering a space now, especially in this post-pandemic phase that we're sort of transitioning into, where people, especially the public, want operators and leaders who understand different spheres of society, because public health now is top of mind for everybody in the world. The ways in which, say, national security and the fight against terror were issues that were top of mind right after 9/11. I was a freshman in college, 45 minutes south of New York City. Literally my first day in a dormitory, my parents dropped me off on the morning of 9/11. I remember that experience, that morning, really shaped the next 20 years, in my opinion. Literally, we just came out of Afghanistan. This is going to be the same for public health. And so making yourself uncomfortable, experiencing different sectors, every part of society, private, public, nonprofit, is thinking about public health in a way that, in my view, they were not thinking about in December of 2019. So with that, the data revolution, productizing healthcare delivery, the militarization of a crisis response, and communication transformation, I think these are the 4 pivot points of public health: the future of care delivery, the future of in which we'll be thinking about optimizing public health for the masses. And so do I mean. I'm just going to dive right in. I serve as, in this health tech space that I found myself in. It's been extraordinarily rewarding and really interesting, because what we've done at Amazon, for example, and this is work I've done with Amazon Web Services, AWS. What we've done is we've been able to actually help scale really interesting diagnostics for clinicians. And I highlight something here that appeals to me as a pulmonologist, but it was super interesting. What we did was we used cloud computing technology, machine learning algorithms, and we worked with collaborators in Italy, pulmonologists in Italy. Yeah, you may remember that before New York got really badly hit back in March of 2020, Italy, Lombardy, was actually an epicenter of the pandemic. And so we worked with a bunch of clinicians in Italy. And what they did was they shared chest x-ray images over time for all their patients with COVID. And we applied machine learning algorithms to this huge data set, tens of thousands of images of chest x-rays of patients with COVID, literally from the moment they hit the emergency room to the moment either they ended up in the ICU to see somebody like me, or at the point in which they were able to leave the hospital and go home. And we built this open source toolkit where you can upload an x-ray image of a patient of yours with COVID, and you can predict what's going to happen. So if they come to your hospital, your urgent care, you can predict what's going to end up happening, because now we've learned from the past, and we can understand, oh gosh, is this patient likely going to end up in the ICU given the nature of their x-ray on day 0? Because we're learning from the past, we're aggregating that data. We call this AI for COVID because, in many ways now we have tools that can help with informing patients and loved ones of what's likely to happen to them over the course of their hospitalization. We didn't have this innovation back in December of 2019, but it took public-private partnerships. Literally, this is an academic institution in Italy working with us on the private sector side to come up with something that's now being utilized across the world. You can imagine how this could really change the game here. I like talking about this. I don't have any financial conflicts of interest. I should have put out my disclosures earlier. I work, I'll say to all of you, I work in a full-time capacity for Amazon. I'm a reservist for the Air Force. And I also have an affiliate faculty appointment at the University of Washington. Those are sort of the 3 areas that I spend my time in the most, in addition to some media work for NBC. So with that out of the way, I came to know of this company and what they're doing in precision medicine and in sort of improving the care experience for the individual patient during my time at Amazon. And I highlight this because this, in many ways, is part of the data revolution that we're living in terms of improving care delivery for the individual. I just talked to you about the ways in which we've been able to leverage data to help with clinical prediction. These incredible innovations using machine learning that now allow me as a pulmonologist to better care for my patients when they come into the hospital earlier in their hospital stay. This is interesting from an outpatient standpoint, because now we have blood tests that are easily accessible direct to consumer. You can actually order this test online. And what it will tell you is it would actually senses for 50 different biomarkers, sort of signals in your blood, that then indicate elevated risk for cancers like kidney cancer or bone cancer, where we don't have an easy screening test. For breast cancer, for example, there are mammograms. For colon cancer, you get a colonoscopy. We have these screening studies that we've used for many years, for many decades. But for so many of the cancers that actually end up killing people because we detect them so late, we don't have great screening studies. So now we've, over the course of the pandemic, this company and others have figured out ways to do early detection, in this case, of cancer. So if you get this blood test, turns up positive, that helps inform the patient experience. It actually allows then a clinician like myself or others to say, okay, well, let's be more frequent in terms of how we look for kidney cancer. We might do MRIs every 6 months. You can envision a variety of different interventions. If the blood test that signals an increased risk for bone cancer tests positive, that we would be doing more frequent imaging, for example. Because the majority of people die from cancers that do not allow for easy screening tests like mammograms or colonoscopies. Breast cancer and colon cancer, for example, because they have good screening studies, they don't kill as many people as melanoma or as, for example, kidney cancer. So this is improving the ways in which we are able to care for the individual patient. This is going to improve all of your health. I mean, all of you are very much at the beginning of your life, beginning of your career. So, I hope this is not relevant to your individual health, but imagine fast forward 40, 50 years from now, a test like this will only improve. It's going to allow you to better understand your own individual risks and allow you to stay healthy for a longer period of time because of early intervention, early diagnosis. That's where we're headed. Clinical predictive tools, early diagnosis, because of the data revolution that we're living in, this pandemic has really unearthed a lot of possibilities here that previously didn't exist. This is near and dear to my heart and is sort of relevant directly to what I've been working on at Amazon over the last 20 months, which is making for a better care experience at home. This is data that was collected by McKinsey early in 2020. And what did they find in this survey data? Right when everybody was saying, first staying at home, doing a lot more work from home, what were employees of large employers wanting from their care providers? Turned out 30% wanted to have the ability to interact virtually with their doc. 30% wanted a readily available COVID test, and about 30% just wanted better information on how to stay healthy. This was almost 15 months ago. And real quick, just to double click a bit on that information piece, the majority of ways in which the world now consumes information on health information is through the digital space. It's not through reading the New England Journal of Medicine or picking up a periodical. It's what's online. It's what's in social media. And this is somewhat dated survey data. This is 2017, well before the pandemic. I present that to you because we are entering a different space when it comes to attitudes on consumerism in healthcare. What do all of you, for example, want and demand from your healthcare provider when you need to see a doc? Convenience, user experience, the ability to get stuff at home. I would argue, I'm biased because one, I'm a doc that's clinical, and two, I've been operating in this space at a large tech company. So of course I have biases here, but I would venture to guess that some of you, or maybe all of you, are at least more open to the idea of not physically visiting your doc whenever you need to see him or her in person, and that you might be more amenable to getting your care when you need it virtually, or to get your test for COVID at home. I put this on, Rebecca already knows I have no shame, and I think you need no shame, or you have to be willing to accept public scrutiny when you're public. And I've been had the pleasure and the privilege of being able to message to different audiences over the course of the last 20 months on what I've seen as a doc in COVID. And I posted this back in August of 2020, when the prior administration was in power, when we were sort of moving towards tests being more readily available at home, just to make the point that you don't need an MD or any healthcare background to be able to do a test at home. And Amazon and others, within a few months, were able to adopt one of these tests at home, this really cool Bluetooth connected test, the Illume test, which is a rapid antigen test, just another type of COVID test that you can do non-RX OTC. That means without a prescription, over the counter. We're actually working now at Amazon on, as are others, on multiplex testing. So this notion of testing yourself for both COVID and flu at home without needing a healthcare provider to prescribe that test. So as some of you, I can imagine that's useful to some of you that might be developing a cold in the coming months. You want to know, well, is that COVID? Is that flu? Am I good? You might want to get tested before you go home for, say, Christmas, for example, if you're on campus and you're about to go visit mom and dad or other loved ones who might be older. That there are other things that cause a fever or runny nose than just COVID that could be harmful to others. So that multiplex testing, introducing that into the at-home environment is going to be really useful. But I bring this to you because before 2020, before this pandemic, the FDA was not really thinking about at-home, over-the-counter, non-prescription based tests for communicable diseases. We just met with the FDA about a week ago to talk about multiplex testing, COVID flu for at-home use. For many months prior to our meeting just a few weeks ago, they just were not there. And now they're there. They're at least willing to consider and look at the data. So things are changing from a regulatory policy landscape as we speak. And that's enabling a lot of these innovations to occur at home. And that's a really good thing when you think about equity in terms of who can access the healthcare system, who can get access to a test easily. It's a great thing when we talk about convenience and the patient experience, that our regulators are working in parallel with the pace of innovation to actually allow these things to be embedded at home. And I think, just checking the time here, Rebecca, I won't exceed past 5:30 Eastern, but we're moving towards a space where that your ability to empower yourself with health information is only going to increase. This is for mom and dad or grandma and grandpa for many of you. But private Medicare Advantage plans, those payment plans, those insurance plans that are available to those 65 and older, some of those healthcare plans are privatized. Some of those insurance plans actually now are offering a subsidized Apple Watch in this case for enrollees. The thought there being, well, gosh, if we give a free Apple Watch to people that are 65 and older, it's going to cause them to maybe monitor their step count day over day, and it's going to cause them to be more wellness focused. That's going to improve health outcomes. That's actually going to decrease the amount of costs that they're going to have to shoulder when it comes to paying for their healthcare bills. So we're moving towards trying to experiment with these at-home devices, these products that you can deliver at home, to hopefully create a more convenient user experience, but also to improve health outcomes ultimately is really the ultimate goal. I did want to just close this discussion by giving you a sense of how rapidly the pace of innovation is changing. As a pulmonologist, we really geek out on things like respiratory rate, oxygen levels, heart rate. I mean, it's just all these things that might seem, pretty basic from when you're just thinking about some of these vital signs. But if you look at those vital signs over time, you can really understand, well, gosh, is somebody sick? If they've had a deviation from their normal heart rate baseline or oxygen baseline, and that deviation is sustained over the course of hours or days, that might actually herald something like COVID, where their oxygen level is persistently below what it normally is. Maybe that's actually a sign of early pneumonia. Even if they're feeling okay, that decrease in oxygen might actually be a signal that something is wrong. Whoops. Well, I normally talk endlessly just about this particular innovation, but I don't have time today. Imagine a better way to monitor those that are the most at high risk of coming back into the hospital, those with chronic heart failure, with lung disease from years of smoking. These are people that are chronically going in and out of the hospital. Part of the reason why is we just don't know what happens when they go home. And now what's actually happening, and this has been an innovation that has scaled and really accelerated over just especially the last 6 months, is this notion of remote monitoring, really meaningful remote monitoring, where we can prescribe one of these bio buttons to a patient. It literally goes right above their nipple line in the mid axilla, so sort of right here, or mid clavicular line. So like right here next to my Patagonia sign, we put it on there. It can be there for up to 60 days, and it continuously monitors a patient's heart rate, temperature, respiratory rate, and soon their oxygen level. And then it learns a patient's baseline. So there's some degree of machine learning involved here as well. So then you can understand, well, gosh, Mr. Smith has persistently had elevated heart rates over the course of the last, say, 48 hours. And a teletechnician is actually watching all this data in real time. There's these sort of teletechnician hubs that a lot of academic medical centers across the country have now developed to help power this. And if something happens that's concerning, if there's a deviation that's concerning for an individual patient, somebody like me or one of my colleagues gets alerted. And we actually, myself or maybe a medical assistant will give a call to that patient to say, is everything okay? There's some kinks that need to be worked out here, but you can see how that at-home healthcare experience is becoming much more rich, much more resilient, much more useful to the end patient, and ultimately also to the clinician, so that we can keep people at home and keep people safe. This is going to seem like a gigantic pivot here, but this sort of goes back to what I was saying earlier about being willing to put yourself out there and experience different things, even if they seem somewhat tangential to your career path. It felt a little random at the time, but I had signed up for the Air Force to help pay through medical school and then do medical training, which often feels like indentured servitude, to be completely honest, because you're not making a lot of money, you're in debt, and you're working really long hours. So the Air Force actually smartly pays young docs at the beginning of their career, knowing that then we'll owe them a ton of time on the back end, which is exactly what I've had to face. I'm 7 years in, I have a total of 9 years of commitment. And we deployed just back in the month of September. I was in Southern Ohio, and it was fascinating. It was actually an experience that I would never, that I'm so thankful I got to be a part of, even though it's really hard work to be a reservist. It's like multiple sort of competing jobs all at once. But this was cool, because what we were doing is we were providing ICU level care at 30,000 feet. This is a C-130. We were moving 4 patients from Chattanooga to the Cleveland Clinic so they could get advanced ICU therapies and in an ICU next to, or that was based at the Cleveland Clinic. And essentially a capability, this is called critical care air transport. And my team here, this is a picture of my team, is an ICU doc, an ICU nurse, an ICU respiratory therapist. We're all part of the Air Force. We're part of the critical care air transport team. These were developed to actually move soldiers downrange from, say, Bagram to Walter Reed because of a battlefield injury. Now they're being co-opted as part of what I think is a militarization of our pandemic response. We don't have enough healthcare workers to staff all the ICU beds that exist across the country. So what are we doing? We're mobilizing Guard. We've mobilized many of our military medical assets to do things that we previously did not do. I mean, truly unprecedented things, but pretty remarkable. And I do think one of the big challenges of your time as you emerge as our next generation of leaders in public health and in healthcare more broadly is, how do we address the healthcare worker shortage? 40% of nurses are going to leave the field by the end of the decade. 30% of docs, partly because of just age and retirement desires, partly because of burnout. This is not sustainable to be able to just deploy the military. We need to think about ways to address that supply demand imbalance. And then lastly, sorry to just be sort of bopping around here across what seemingly very disparate pivot points in public health as I'm referencing them. But this notion of communication transformation, to me, if there's one thing that I've been involved in over the last 20 some odd months, whether it's direct patient care, the tech side of the home healthcare experience, or this, just communication, I think this is where there's the most white space, the most ability for your generation, you as our future leaders, to make really sustained impact and to reach the most number of people possible. I'm showing this side by side just to give you a sense of what do I mean by that. The New England Journal of Medicine, obviously, is sort of one of the Bibles of medicine, arguably the most prestigious journal in clinical medicine in the world. This was the most viewed and one of the first publications on coronavirus published in the journal. And I looked at the page views, and it was about 1.6 million back when I took this screenshot, many months ago. And at the time, I remember showing a picture of my patient's lungs with COVID and comparing it to normal lungs. It was this. I'm going to come back to this slide in just a second. And I tweeted that, and I just said, that the purpose of vaccination was to prevent your lungs from looking like these lungs. That was kind of the riff on the tweet. And the number of engagements were almost 4 times higher. I'm not in any way suggesting that Twitter is going to replace the New England Journal of Medicine. That's not the purpose here. But it is, in my view, at least my own personal experience with observing and being involved in the transformation that is actively occurring regarding public health information, both how we deliver it and how we consume it. That the majority of people, remember that survey data that I showed a few minutes ago from Rock Health, in 2017 was showing that most people consume healthcare information in the digital space. That was in 2017. Now I think it's only, that trend line has only increased. That how we consume information has dramatically changed over the course of my, the last decade of my life, much less yours. And I think it's going to continue to change. And yet we don't have best practices on how to use media, social media, to get the best information out there. I'm going to skip through this because I know I'm running out of time here. I'll just close on this to say that, in addition to sort of being a part-time medical analyst for media, one thing I've noticed is that in reaching people through clear, concise messaging, you can have impact in public health that is unrivaled. I thought the best way for me to have impact, for example, was by being a clinician at the bedside. At least that's what I was thinking when I was coming up the ranks, going through years of training. And what I realized over the last 20 months is actually, if you can be credible as a messenger, and you can really master the art of communication, which I'm still trying to learn, you can really reach people and you can have incredible impact. And I cite this just to show that I'm not completely full of air, or hot air rather, just to say that there have been signs in my own experience where I feel like getting right information out there. The Seahawks, for example, one organization I've talked to, one of the common questions I got was, "Hey doc, why do we get the vaccine?" Because I know all these people that are testing positive after they've been fully vaccinated. And I think this goes back to what I was trying to cite here, what I skipped over, which is, I think there's been a lot of confusion about why you get the vaccine. I think there's been underutilization of concise messaging tactics, like using visuals, which we often use for the anti-smoking campaign. Turns out that they would be beautifully, they would sync beautifully with our aims in trying to convince people to get the vaccine, because COVID does pretty dramatic things visually to the lungs. So it's all to say that for you guys, for everybody here in this class, and you're just reflecting on the last 20 months, talking to various people and how they've spent the last 20 months in terms of trying to have impact, I do think one of the best ways we can have impact moving forward, and I'm constantly trying to think about best practices, in this space is how do we communicate better to people, and how can we really acknowledge that at the end of the day, it's all about behavior, whether it's smoking, whether it's getting the vaccine, whether it's wearing your mask. We often know what the right thing is to do in public health. It's often just convincing people and persuading them. And I will say for me, as a doc, I didn't go through formal communication training in medical school. I mean, this is something that I constantly try to learn and get better at. And I think all of us would do a lot of good for broader society if we, took it upon ourselves to try to be the best communicators possible. So I'll end on that note. I know there was a lot there, but I think just to emphasize, there are so many different career paths open for all of you, in my opinion, as a result of this pandemic. Don't be constrained by dogma, take risks, and I'm glad to chat more in the Q&A.
And thank you so much. Thank you for speaking us today, for kind of talking us through your multiple hats that you've worn throughout the course of the last couple of years, from the new innovations in technology to the being able to show what your military service has looked like, and then also with deep gratitude for this role as one of the kind of go-to communicators. And so thank you for all that you have done, and we're so appreciative that you joined us here today.
Thank you for having me.